morning po, ma'am. Naalala niyo pa po ba ako?
Jan, hello. Jan, hello.
Ako po si Jan. Good morning, Ma'am Marcy. Kamusta po kayo?
Okay naman.
Mukha po kayong galing ng marathon na.
Nag-marathon ako sa Las Vegas.
Therapy for Wernicke's aphasia is a syndrome-specific treatment approach created by Helm, Estabrook, and Fitzpatrick. This was adapted from the deblocking program created by Olatoska and Richardson, which used written stimuli as a stable representation to anchor auditory stimuli. Candidacy. Patients must be diagnosed with moderate to severe Wernicke's aphasia with a difficulty in processing single words through the auditory modality. They must have single word reading comprehension skills, and they must be able to read single concrete words aloud. Selection of stimuli is where we obtain the baseline skills of our patient. In choosing word stimuli, they must be words that can be matched with its pictorial representation. These must be words that the patient can read aloud, and these must always be presented in lowercase. Other words can be obtained based from the performance of the client on a formal test. Clinician may decide to add stimuli of high probability, high emotion words, or low probability words with a unique configuration. The patient is able to recognize 100 words through the auditory modality by pointing to pictures on command. Clinician may introduce picturable minimal pairs.
Okay, ma'am. So, ngayon po, ang gagawin po natin, magpapakita po ako ng word po sa inyo, tapos ang gagawin nyo po ay ima-match nyo po yung word sa mga ipapakita ko pong picture. Malinaw po ba yan?
Oo.
Po. Okay, ma'am, ito po mga ipapakita ko pong picture sa inyo. Ito po yung mga ginagamit nyo po sa pang-araw-araw. Ma'am, ang first word po natin ay
Step 1. Matching a printed lowercase word to its corresponding picture
So,
representation.
ma'am, alin po dyan ang sa tingin nyo po, nagmamatch po sa word na to? Okay, tama po.
Step 2.
Pakibasa nga
Reading
po
the
ng
word
malakas.
aloud.
Toothbrush.
Okay, tama po. Okay, ma'am, ngayon po, gusto
Repeating
ko
the
po,
word aloud
ulitin nyo
as
po yung
presented by
sinabi
the
ko pong
clinician without the presence of the printed stimulus.
Toothbrush.
word. Okay, tama po. Sige, ma'am. Ibabalik ko po yung mga picture.
Step 4. Correctly selecting the pictorial representation of the word from a group of 8
So, ma'am, at tingin nyo
upon
po,
hearing the
alin po
words
dito
spoken
sa
by the
mga to
clinician.
ang toothbrush? Okay, good job, ma'am. Yan po ang toothbrush. So, ang next po na ipapakita ko pong picture, ito po yung mga ginagamit natin na pangluto. Okay, tama po. Ma'am, pakibasa po ng malakas.
Knife.
Okay, tama po. Ngayon, ma'am, gusto ko po na ulitin niyo po yung sinabi niyo pong salita.
Fork.
Okay, ma'am. Ang sinabi niyo po kanina salita, ma'am, ay knife. Pakiulit nga po.
Knife.
Okay, tama po. Sige, ma'am. Next word na po tayo. Saan po dyan tingin niyo, ma'am, nagmamatch po sa word na to? Okay, tama po, ma'am. Sige, pakibasa nga po ng malakas, ma'am.
Egg.
Okay, tama po. Sige, ma'am, ngayon po, ulitin niyo po yung kakasabi niyo lang po na salita.
Egg.
Okay, tama, ma'am. So, ngayon, ma'am, babalik ko po ulit yung mga picture. At Gusto ko po, sabihin niyo po sa akin, alin po dito sa tingin niyo ang egg? Okay, ma'am. Good job po. Tama po. Ma'am, so good job tayo today na-identify niyo naman po, naulit niyo naman po yung words, yung mga target words po natin. So, next session, ma'am, inaasahan ko po na babalik po kayo dito para sa ating therapy sessions pa po. At saka practice din po tayo sa bahay, ma'am, ha? Okay po. Maraming salamat po. Thank you.
In charting progress, the score sheet should always have spaces for listing the target words and the response of the client. If item is identified successfully at step 4 for 2 consecutive sessions, item is dropped and new words are added. If therapy is appropriate for the patient, the mastered list of words will expand after the 3rd session. After 5 sessions and no improvement is observed, modify the approach or change the therapy technique. Evidence-based practice. As reported by Esther Brooks, there is still no formal study conducted to support the therapy for Wernicke's aphasia. And due to the limited references available, the evidence-based practice used was Olatoska and Richardson's A Longitudinal Study of an Adult with Aphasia, Considerations for Research and Therapy. An analytic experimental study entitled A Longitudinal Study of an Adult with Aphasia, Considerations for Research and Therapy was conducted by Hannah Christina Olatoska and Sharon Mendel Richardson. The study was administered to a 62-year-old right-handed white man who was a retired accountant with known essential hypertension for 13 years. The patient showed severe impairment in his ability to recognize pictures of common objects or to follow any commands presented to him. His verbal expression was characterized by fluent but unintelligible phrases interspersed with a few intelligible automatic responses. The traditional therapy technique and the deblocking program were both administered to observe progress during therapy. The traditional therapy technique program included having the patient to point to objects, pictures, and words on command. Numerous recordings were made of the patient's speech to help the patient hear his verbal output. The patient was also asked to practice copying shapes and letters and to match printed words to its pictures. The deblocking program used drills and are as follows. 1. Match the phrase to an appropriate picture. 2. Point to the appropriate phrase on command. 3. Point to each component word on command. 4. Point to picture on command. 5. Listen to the phrase as read by the clinician. 6. Answer simple questions pertaining to the phrase by pointing to the correct card. Outcome. Overall improvement has been noted in comprehension of language, auditory retention of 3 words, recognition of language errors, comprehension of reading material, repetition of single words, decrease of jargon, retrieval of words, spontaneous writing of his name and numbers, copying sentences, and improved in gestures.